Speaker, my question is to the Minister of Health. Speaker, this government's mismanagement of the Ontario healthcare system has resulted in a hospital overcrowding crisis. This Liberal government is responsible for Ontario's hospitals suffering through 4 years of frozen budgets. This government has continued to cut funding, pushing our hospitals to the breaking point. Speaker, the Auditor General warned that hospital beds were unnecessarily being occupied by patients waiting for long-term care beds or home care, causing delays. Unfortunately, the government didn't listen to the Auditor General, and now over 4,000 hallway patients at the Brampton Civic Hospital are paying the price. Speaker, my question to the Minister, given hospitals are at a breaking point, what is the Minister doing to end hallway medicine?
Hear, hear. Hallway medicine.
Chief Government Whip will come to order, and whoever it is that's nervously kicking their desk, I would appreciate it stopped. I'm speaking and I'm standing. Minister of Children and Youth Services, second time. Minister of Transportation, come to order. We're now in warnings. Minister of Health.
We're making investments across the healthcare system. We're making investments in the operating budgets of our hospitals, an additional $500 million this year, approximately $500 million last year as well. And we're making the biggest capital investment to deal in the medium and long term on the growth of the population and the aging of the population, a $20 billion investment in our hospital infrastructure over the next decade. That's unprecedented. That has never happened in this province before. And last week, Mr. Speaker, the addition of the equivalent of 6 new hospitals, 1,200 inpatient beds, on top of the nearly 1,000 beds that we've added in the last 4 years. We're adding an additional 1,200, Mr. Speaker, and an additional 600 transitional beds at places like the Finch site, the former site of the Humber River Hospital, at places like Hillcrest, which is a site of the University Health Network here in Toronto. We're making the investments, and we're doing it in partnership.
Supplementary.
Thank you, Speaker. Speaker, the government is ignoring the 4,110 patients who are sitting in hospitals with nowhere to go. Wow. Mr. Speaker, 4,352 patients have been admitted in the hallways at Brampton Civic Hospital in only 1 year. Patients must deal with excessive noise and a lack of privacy that reduces their quality of care and prolongs recovery time. Instead of investing in patient care in the community and long-term care, the government continues to invest in their large bureaucracies and huge administrations. With flu season around the corner, we're going to start seeing more stories like Brampton Civic across the province. My question to the Minister, what work has been done to address the alternative level of care issue in order to end hallway medicine?
Hear, hear. Hallway medicine.
Minister.
Thank you, Mr. Speaker. And the opening of nearly 600 transitional beds, like the reactivation care centre at the Finch site of the former Humber River Hospital, where there are ALC patients in hospital that no longer require acute care. Mr. Speaker, they don't need to be in hospital. And so we're finding different ways to provide them with the support they need. For example, the additional $40 million this fiscal year invested and announced last week in home care, or the transitional spaces, like the 150 spaces that will be made available at the Finch site, the spaces available at the Hillcrest site here in Toronto, and similar investments being made all around the province to pull those ALC patients out of hospitals where they no longer need to be. But it's rich coming from the PCs that closed 10,000 hospital beds, Mr. Speaker.
Thank you. New question, the member from London West.